My career pathway to date has been tremendous. Over the last 35 years, I've had enormous opportunities as a registered nurse to work in a number of different places and spaces and fulfil many really exciting roles. So I started my career working with children and young people with intellectual and physical impairments, which I absolutely loved and adored. And I found myself moving from that clinical kind of coalface place to learning and development. And very quickly, it was at the time when nursing moved from hospital-based training into universities. And I actually found myself working as a part-time lecturer and teaching student nurses, which I also really thoroughly enjoyed. I've also worked in a large paediatric facility in a number of different roles as a clinical nurse consultant, and also running a large emergency department and community outreach services along with that. Of recent times, I've spent some time working as a consultant for one of the big fours, where I learnt lots of the business acumen that you need to bring to the healthcare sector, which has been, again, really contributed to my career development. And I've just got a brand new job, which is now working for Children's Health Queensland as a Senior Director in Business and Performance Improvement. So I'm really looking forward to those new career opportunities that's going to unfold for me as I learn some more. So the aspects of leadership that are really important to me include being true and authentic to who you are. So working according to your values and your beliefs, because that is reflective in the behaviour that you demonstrate when you engage and interact with other people. I think also being very clear about where the line is around your expectations. I think people need to understand what it is that you're looking for as a leader in the way that they conduct their work, they conduct critical thinking and interact with patients and deliver patient care. The other thing I think that is important is the ability for you as a leader to actually engage people and take them on a journey and enable change to occur. And again, I think those the things around being authentic is the way in which you would take people on that journey. Advancing nurse leadership is at a really critical time for us as a profession, I believe, not only as individuals but as a collective. I think as the system demands us to be much more cost effective, I think that we have a critical role in contributing to the way in which we enable that to happen. And I think some of that is about our ability to be able to qualify and quantify the value add and the contribution that nursing makes to patient care, but also to the system as a whole. We often talk about what are our challenges, and I think that one of our biggest challenges is that we actually need to stop talking about our problems. We've done that for a long time. We've got expert researchers that have published multiple articles on the things that we continue to butt up against and are challenged by. I think it's really timely for us now to consider about how we actually mobilise. We have great ideas on the way in which we can actually fix some of those problems, but I think we need to develop a really clear strategic plan and be quite specific around what are the benefits and the risks of actually making change, but we need to get on with it and stop navel gazing and really think about how do we excite not only our profession but the people that we collaborate with across the system. We really need to think about mobilising the change that needs to occur, but being really clear about what does that look like, what are the steps that are involved. So we're not only creating the vision and the destination that we need to get to, but our colleagues are really clear around what are the individual steps that will actually help us to achieve that. Be very clear about what are the benefits and the risks to doing those things, and what are the measures that we're going to put in place that tell us that we have actually succeeded in implementing that change. The thing that I am the most proud of as a nurse leader I can remember a time when I was given an opportunity by another leader who took a risk and allowed me to lead a team of people, and I was able to, over a period of approximately 3 years, move the service from one that had many complaints, not very many compliments, where staff had very little self-respect, let alone respect for each other, to actually see them grow and mature through a range of different strategies and collaborative approaches, to see them blossom and grow into individuals who loved coming to work, who loved giving care, to a collective group of people who innovated, who used evidence-based practice to actually make a change for the kind of service that they wanted to deliver. I'm also incredibly proud of the opportunity that I had to work with the Chief Nursing and Midwifery Office of New South Wales and Deborah Toms, who was the Chief Nurse at the time, on a statewide project called Take the Lead. And the aim of the project was to strengthen the capability, to strengthen the leadership and management capabilities of nursing and midwifery unit managers across the whole of New South Wales. So I had a really privileged place to be able to interact and work with over 1,800 nursing and midwifery unit managers and acting unit managers across the state, to understand what it was that they required to be much more effective in their role, and then to take that information away and actually build for them a conceptual framework that would articulate their purpose and their function and their aim, but also develop a series of modules that supported them and gave them the skills and capabilities that they absolutely required to be the most effective and the most efficient, and to be really awesome frontline managers across the state, and to see that implemented.